Hello listeners, welcome to Views on Health. Back on the program today is Dr. Manitha Perera, consultant physician, who last time around focused on non-alcoholic fatty liver disease. But tonight on the program, the focus is on polycystic ovarian syndrome. I assume this is also another common problem that you come across in your regular practice, doctor?
Yes.
Having said that, may I ask you to please introduce the topic? The microphone is yours.
Yes. Thank you, Fatima, and thanks for having me here. So today we are going to talk about polycystic ovarian syndrome. So this is a common condition that affects females, and this can affect again a wide range of age groups, ranging from around the puberty all the way up to menopause in females. So it's quite a relevant topic, and let's go through the topic in detail. But as an introduction, polycystic ovarian syndrome is a hormonal disease which is caused by hormone imbalance. And widely it is manifesting with menstrual irregularities. So periods can be, a bit haywire. And then you can have unwanted hair growth in your face and your body. But these are few things that, catch, attention of the female. But then again, this is slightly more deeper and beyond the cosmetic as well as menstrual aspects of the disease.
Thank you, doctor. So I'd like to say straight away that I've come across a fair number of young ladies, women, who have had this facial hair growth, and it's certainly upset them. It's upset the entire family. And how do they overcome it? Yes, they have overcome it as far as I know. So could you just advise us on that, please?
Yeah, so excess hair growth, technically we call it hirsutism. And this could have many reasons. I mean, you can have just hirsutism without any one of these diseases. And also you can have it due to polycystic ovarian syndrome, which is a topic today. And then it could be due to certain drugs you take for certain diseases. So it can have many reasons. And also certain people, according to their ethnicity, can have more facial hair than some other ethnicities. So it is a wider topic. They could have many reasons, but then polycystic ovaries is one of them. So we will be talking about the clinical features. Before that, let me just give you an idea as to what type of burden is this disease in our community. So it is quite common. Usually it occurs around the time of, puberty. But then initially the periods can be irregular in any girl once they attain. So this might not be, coming into attention until late teens. So it occurs around puberty, but then it can again catch a lot of attention during the early 20s. With obviously the cosmetic aspects of it, and also because this can cause infertility and subfertility. So during the reproductive age group, females come with this problem commonly to our practices. So it can range anything from 5 to 20% of people. It could be even more, which are being undiagnosed in the reproductive age group, being affected with this condition. So if you look at what happens here, essentially, as I told at the outset, it is a hormonal imbalance. So generally, again, this is associated with obesity or high body weight. This will cause certain hormonal imbalance with insulin resistance. And also sometimes there are changes in the way your brain secretes, the sex hormones. All of these things will cause changes that amounts to this syndrome. Why we call it a syndrome is it's not just one symptom, it's sort of a constellation of several things put together. So, yeah.
So, doctor, now you said this is from the time of puberty right up to menopause, a long period of time in a woman's life or young girl's life going into,
adult life.
Yes, young adults and into womanhood. Having said that, doctor, how does this impact on one's life? I mean, if this condition is set in the system, obviously you will treat it once you diagnose, but till such time, or even after being diagnosed and you're treating it, still, how does it affect a young girl, for example?
So it can affect a lot. So let's go through the clinical features that will tell us what type of implications the disease will have on the subject. So one thing is the excess body hair. This is due to this hormonal imbalance causing excess androgens. Now, androgens are things that are there in females but in less quantity. These are the exact hormones that cause the beard to be grown in males and the voice to be deepened. So generally these hormones are lying at a very low concentration in females, but in polycystic ovarian syndrome, these hormones can rise above that level. So even testosterone can rise slightly above the upper limit in polycystic ovarian syndrome patients. So with this, you start to develop excess facial hair as well as body hair. It can be in the upper arms, upper thighs, between your breast, in your tummy, on your upper lip. So everywhere it can have excess body hair. So this is cosmetically sometimes very concerning. So even the teens as well as young girls, as well as even into womanhood, I'm quite sure it will have a huge psychological impact. And one of the main presentations of this disease actually to, even to the GP or to the dermatologist, even the cosmetic physicians with this concern. Together with this hair growth, these androgens causes excess acne. Again, it is a bit of a cosmetic concern. So excess acne and excess hair growth is, I think, significant impact on one's, quality of life. It can also cause a bit of hair loss as well on the scalp. And then menstrual irregularities. I told you at the outset, there's a hormonal imbalance. So with all of this hormone imbalance going on, the way the follicles mature in your ovary changes, so that your follicles don't mature properly, so you don't ovulate as such. So as a result, your periods become quite irregular, and then patients present commonly to the gynecologist with irregular periods, which can be late or sometimes even be absent for some time, so that patients become concerned that their periods are missing. Some people even take pregnancy tests to realize they are not pregnant. And then, so menstrual irregularities is one of the main ways this disease presents. Then with all these things going in your ovary, this is essential for your fertility. So then subfertility and infertility is the other main presentation and one of the main concerns in this disease. So your ovum are not maturing, you're not ovulating properly. So as a result, there's no chance of fertilization. As a result, these patients with polycystic ovarian syndrome, it's commonly called PCOS, and patients with PCOS present to gynecologists and obstetricians with subfertility. So if you or anyone you know is suffering from difficulty in conceiving and subfertility, this is one of the main causes. This topic that people can present to a doctor and check themselves for this disease. So those are two main manifestations, androgenic symptoms and menstrual irregularities. But then at the beginning I told that this condition is beyond the skin or the cosmetic aspects and the menses. So it has wider metabolic implications. So as I told, this is widely associated with obesity and weight gain. And also this is known to be associated with diabetes and then with cholesterol. So these patients are more likely to be having high blood pressure. So these are the metabolic, diseases we are looking at. And also these patients can have high risk of, non-alcoholic fatty liver disease. And also psychologically. Now we spoke how these manifestations can cause an impact on the, one's life. But then we have also found when we look into PCOS community, they are more prone to depression and anxiety than general population. As well as they are more prone to have eating disorders like bulimia and even move into anorexia. So there are wide implications beyond just, the cosmetic aspects as well as, the menstrual irregularities.
So it is treatable because it's a hormone imbalance.
Yes. It is a treatable condition.
So would you say that, say, a girl in her early teens has this condition or these conditions and it's diagnosed as polycystic, ovarian syndrome, and then you treat it. So can that treatment be taken as, okay, this is done and now she's over it?
Yeah.
Or can it recur because you say it can go up to menopause?
Yes. So before going into the treatment aspects, let me just briefly mention about how you diagnose this. So it is a clinical diagnosis. So females in their reproductive age group who are presenting with either menstrual irregularities, lack of periods or delayed periods, which we call as oligomenorrhea, and then also with androgenic symptoms, excess unwanted body hair. So these patients are thought to be having polycystic ovarian syndrome if it fits the clinical profile. And then when you have excess body hair, your doctor might decide to do a hormonal profile. And how deep we go in hormonal assessment depend on varies from patient to patient, but generally we might do a testosterone level. Some selected patients we might do LH, FSH. These are the brain sex messengers. So your doctor will decide sometimes prolactin hormone to see whether there's another reason for this excess hair growth. So depending on your clinical profile, your doctor might go a bit deeper. Then your doctor might order an ultrasound scan of your ovaries. So the name comes because of it's called polycystic. So there are little water bubble type of appearance in your ovaries. This is what is called polycystic appearance. Now, having said that, not all patients will have this scan change. So just because your ovaries are not showing these changes doesn't always tell you don't have the disease. So if you look at menstrual irregularities, yes, it is commonly there, but some patients can have polycystic ovarian syndrome without the menstrual irregularities. They have perfectly regular menstruation, but they have excess body hair, and sometimes in the scan you might see the cyst. And then rarely there can be a patient without even excess or at least more recognizable excess body hair, but then have menstrual irregularities and with the changes in the scan. So not all patients need all three to diagnose. It's a clinical diagnosis. And also your doctor will check you for your lipids, your sugar, and your pressure, because I told these are associated with body weight and metabolic parameters. So then moving on to treatment. Yes, it is a very treatable condition. Very much treatable, and you can actually lead a completely normal lifestyle if you treat it right. So this is related to body weight. So body weight reduction is one of the cornerstones in management. So again, your doctor will advise you on a healthy lifestyle, cutting down on carbohydrates as well as your fat intake, lipids, and exercises. So when you look at something like a 5 to 10% weight reduction, so as you reduce your weight, you start to see your periods are returning. And it's sometimes quite miraculous. Some people are astonished to see how drastically you improve with weight reduction. So one thing that you should remember is polycystic ovaries in anywhere in the world, even in developed healthcare systems, one of the cornerstones of management is lifestyle modification. So weight reduction takes you a long way. So your periods will start to return. And there I should mention something that you could be, subfertile because of this disease. So if you are not contemplating on pregnancy, as you reduce your weight and you go through that journey, you can have accidental pregnancy also. So if you're not contemplating on pregnancy, you should now consider contraception, because otherwise you will end up with unwanted pregnancies. So such is the improvement you achieve with weight reduction. Then the rest of the management will vary according to whether you are contemplating pregnancy at the moment or whether you want contraception. So say if you're not planning on becoming pregnant at this right moment when you present to the doctor, then we might put the patients on hormonal pills. So this is very similar to the contraceptive pill which people know about. And essentially these pills are containing hormones, estrogens and progesterones, that can sort of reset the system and correct the hormonal imbalance. And this will subsequently regularize your periods, as well as what is more important is this will also address the androgenic symptoms. So your hair growth, unwanted hair, everything will start to improve once you're on the hormonal pill. Only thing, you have to be a bit patient. This is something that came because of a hormonal imbalance. It takes 1 month or 2 months to see a response. So your excess body hair which has erupted already might not disappear in a day or two or even in a week. So you might have to apply your physical methods of removing, vaccine, laser treatment, all of those things you can do in parallel. But as the treatment kicks in, you will see a good response in your hair growth as well as in your periods.
Doctor, you spoke of a scan that might show a cyst. What happens there?
So this is one of the changes that appears in your ovarian structure as a part of your hormonal imbalance. It is not generally essentially the whole reason of this disease. So it is sort of, let me put as a marker of the disease that you see on imaging. So if you see that, yes, there's a way that radiologists describe a typical feature of polycystic morphology in your ovary. If you see that, yes, it is a strong pointer for the disease. But then again, absence of it doesn't exclude the disease.
But if it is there, is it removed?
No, you don't remove it. It's just there. It's just a manifestation of the disease. The ovaries are needed for you to lead a, sexually active and balanced life. If the ovaries are taken out, you become surgically menopause. So you don't take off the ovaries, you tackle the condition and, reset these hormones in a way that the problems we discuss about the fertility to menstrual problems to androgenic symptoms improve. Then if we were talking about if you don't need pregnancy, then if you are contemplating on pregnancy, at that point, obviously you can't go on hormonal pills because these pills will offer contraception in addition to treating PCOS. So if you're contemplating on pregnancy, your doctor's first message to you is lose your weight. As you lose your weight, you will naturally conceive most of the time. There's a good success rate. So if you fail to, conceive even after sufficient weight loss and going through this healthy lifestyle, then your gynecologist and obstetrician will do induction with certain medications for your, ovum to mature in a way that it is fertilizable. So then we will start you on induction therapies to assist with fertility. So there are options again, but then again, treating PCOS with weight reduction and healthy lifestyle will assist you with fertility as well. So those are the two main methods. But then looking into your metabolic parameters like watching your liver for fatty liver, taking your sugar under control, and then monitoring your blood pressure. If you have high cholesterol, treating them. All of these things come into picture when you're treating polycystic ovarian syndrome.
Going back to what you said, and I mentioned it a while ago, that this condition can manifest from puberty right up to menopause.
Yeah.
So can a girl who's reached age of puberty just carry on, and life goes on for her, and somewhere midway, say late 20s, early 30s, can this condition start at that point in time?
Yes. What is most of the time happening is we don't know when it started because we diagnose it when the patient presents. So different people have different stimuli to present to the doctor. For example, you might have gone through your teens with a little bit of excess hair than your peers, but it didn't really bother you. And then you come to the doctor in your, let's say when you're 27 after marriage with subfertility. So then you might think it erupted at that point. But your doctor might say otherwise. He might ask your history from your, even up to menarche, and then he might even tell you, look here, you might have had this before, but yes, now only it has impacted you in a way that you are looking for, medical advice. So yes, it's very difficult to say when it first starts. Usually it starts around the puberty, but the time of presentation can vary. Sometimes you can have polycystic ovaries and you have conceived naturally and you have 2 children, and then you present subsequently at a point where this hair growth is now a problem for you. So you never know when the patient presents, but then it is a disease that spans a wide range or wide number of years during your reproductive ages. And since we have been talking about from puberty to menopause, actually this disease doesn't end at menopause. Even doesn't end at menopause. So what happens is, because these androgens go down even in people without PCOS, this androgen, I told it is present in a tiny amount in any female. These are anyway going down with age. So these are going down in age even in a PCOS lady. So therefore your symptoms might start to reduce. So with menopause, it might be a bit difficult to comment on, PCOS status. So sometimes some people, even after menopause with excess hair, might be actually PCOS patients who didn't know they were PCOS during their reproductive age, who has become menopause. Now still those certain hormonal imbalances might persist well into menopause. So it's actually staying there with you. If it occurs, it stays there with you, but then it is a very much treatable condition. And as we discussed, I think multiple specialties will come into play. Your doctor, your hormone specialist, as well as your VOG, the obstetrician, gynecologist, different phases of your life, dermatologist, cosmetic physician, a lot of people will come into play, a nutritionist, when you are treating this condition.
Dr. Time has caught up with us. It's been very interesting listening to you explain this condition that affects a large number of women, I think, from women as in from teenagers right up to menopause and beyond, as you said. So what is your take-home message?
Yeah, I think it is a treatable condition, and it has very common manifestations which we see among females. So if you are a patient who has excess unwanted body hair, if you are having menstrual irregularities, or if you are having fertility issues, then I think you need to look into this, and you have to consult a doctor and check yourself whether you are suffering from this condition. And also it goes beyond your skin and periods into metabolic risk. So paying attention to that aspects once you are diagnosed is also important.
Thank you, Doctor. And there we end this very interesting discussion on polycystic ovarian syndrome. To you, Dr. Manitha Perera, we express our sincere thanks for being with us on the program in the midst of your busy schedule. Thank you so much.
Thank you very much.
Thank you too to Damayanti Columbage for technical assistance. I'm Fatima Razi Carter saying good night and looking forward to your company next Monday, same time on Views on Health.